Let me take a few moments to introduce the panelists. I wouldn't want to delay it further. It's going to be a very interesting discussion. Our first panelist would be Dr. Sundareshan, the director of Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield. Please welcome. He is also the chairman and consultant Department of Orthopedics in the Institute of Higher Medical Sciences in Prashantigram and Whitefield. He has held many and important positions across departments in MS Ramaiah University, and the list goes on. I wouldn't want to go into it. A highly trained and accomplished professional, Dr. Sundaresh has been instrumental in setting up major departments in orthopedics and spinal surgeries, and has been deeply involved in research and implementation of state-of-the-art technologies. Reckoned among the best in his field, he has been a visiting professor to numerous universities in India and abroad. He has also been very active in extending healthcare to rural India. Of course, needless to say, he's one of the icons and backbones for the hospital here in Swami's ecosystem, Dr. Sundaresh. I would like to next invite Mr. Venkatesh Iyer, Head of Commercial Women's Health, Mylan Pharma. He comes with rich experience in both healthcare and sales and marketing, having been in senior leadership roles in Femicare and Bharat Serums and Vaccines prior to Mylan. In his 15-year stint with Femicare, he was instrumental in transforming a small family-run business into professionally run international player in reproductive healthcare. He was the director of corporate strategy at Femicare for 7 years before taking up newer challenges in Mylan in 2015, whereas the head of Women's Healthcare Division for Emerging Markets is responsible for the sales and business development in those regions. Of course, he also holds MBA from Sathya Sai Institute of Higher Learning, batch of 1989, prior to which he did his MBA. Our next panelist is Mr. Karthik. He's Manager Insurance Initiatives for Tata Trusts. Karthik. He comes with deep understanding of the insurance industries. He has been instrumental in initiating a massive initiative, Swastha Kutumbam, to provide free health insurance for over 1 million people living in over 250 villages of Vijayawada. Prior to Tata Trusts, he worked with TCS and then served with NTT Data Corporation as a senior consultant in the insurance practice. He holds his master's in chemistry and MBA from Sathya Sai Institute of Higher Learning, where he studied from 1996 to 2003. Karthik. I have the honor of inviting our next panelist, who has dedicated his life in the service in the healthcare environment, Mr. Gunaranjan, founder, United Care Development. Gunaranjan founded UC Development Services, as it is known, in 2009 to improve access to free and quality healthcare in primary care, tertiary care, and palliative care. Prior to UC, Gunaranjan worked for 7 years at a large NGO called Basics, working across functions and places in India. During his stint there, he was involved in developing a large micro-health insurance program covering nearly 2 million people. Gunaranjan completed his primary school at Sathya Sai School in Ooty and rest of his schooling in Sri Sathya Sai Higher School, Secondary School in Puttaparthi. He went on to complete his MSc in Physics in 2000 and MBA in 2002. He is Sathya Sai Institute of Higher Learning all his life. Gunaranjan. Let me introduce our next panelist, who comes with a wide experience with marriage, healthcare, with digital and technology, Mr. Manish Sharma. He's currently leading the healthcare initiatives as an advisor to Singularity AI IT. Prior to that, he was the editor to the Healthcare Institute Expert blog. Manish is an entrepreneur with a passion for marrying digital and technology to healthcare initiatives. He has worked with and advised healthcare providers across the spectrum in strategizing and implementing innovative healthcare IT solutions. His expertise lies in the complex field of data, insights, impact in the context of healthcare. Manish Sharma. And Last but not the least, we have our next panelist who will also be moderating this panel discussion, Mr. Vineet Basotia. Vineet has his career deeply rooted in marketing, research, and analytics through and through. His career spans across important leadership roles in Genpact, Fidelity, and currently in GE Healthcare, where he has not only offered analytical solutions, but also been instrumental in building analytical competency for the businesses. Being among the thought leaders in the healthcare and analytics world, he is a regular invitee to national and international conferences and academic forums to represent the voice of the industry. His educational roots lie within the portals of this university as well, where he did his BCom and MBA, which culminated in a doctoral program through which he earned his PhD in corporate governance and strategy. In his current capacity as the Global Director, Market and Commercial Analytics at GE Healthcare, he is responsible for driving innovative and cutting-edge outcome-based data-driven marketing solutions for all of GE Healthcare across regions and products. Please welcome Dr. Vineet. And with that, I'll hand over the panel to him. The topic is multiple dimensions of healthcare ecosystems, which we can understand by the diversity of healthcare-related professions which the panelists represent.
Thank you, Jaideep. It's been a great flow today, and we have had so many different aspects already covered. So I think this is probably the last bit, but probably when I put myself in the shoes of the student, and the reason we are having this workshop today, what's going on in your mind is that how does it all come together for me? And what could be a better panel than the director of Swami's Hospital in Whitefield, along with 4 alumni who are experts in their own field. So getting back to the topic, okay, I probably gives you, I can come here. Here. Then you'll be passing a lot of mic. The topic of dimensions and different categories which are relevant in the healthcare world will probably get covered from few other angles. And the concept which we will use today is that I'll go around our panelists and I'll ask them to share stories and experiences. And we want to target this to the students. And as you know, that with the vision of our institutions, our hospital, they want to really invest in healthcare management. They want to provide you electives. Probably you would be the first batch who would get onto that path. But we see in this a bigger plan of Bhagwan, and maybe a much bigger, kind of a, I would call it, emergence or penetration in a sector which was very dear to Bhagwan's heart. When Bhagwan used to talk about the healthcare world, and I remember my PhD days, at one time he asked us to probably drop a PhD and go and join the hospital. It was very dear to him. So maybe this is just the first step of a bigger journey which is going to start. And let me, again invite you all, the panelists, to the stage. Probably it's right to, start with Dr. Sundaresh. My first question, Doctor, is when you look at your current role and when you look at your story, moving from a physician to an administrator, what would come up top of your mind, which you would say are the top 1 or 2 game changes which drives you in our job today, in our role today?
Thank you, Vineet. Before I start talking about my journey as an administrator, I'd like to just make one statement. Hearing the wonderful exposition of Dr. Siddharth Anji and Dr. Gupta and Hospital. If you analyze what they have said in great detail or superficially, you will find this incorporated into the healthcare system in its entirety. That is why I made a request to Dr. Siddharth Anji to put in writing whatever he said, so that we can keep that as a document for training people who are interested in that. And so about this Dr. Gupta and Vasudha. Well, I became an administrator by force. The circumstances of it are not of great import today, but basically I'm a hardcore orthopedic surgeon who was interested in practice of orthopedics. Trained at Manipal and joined the MS Ramana Hospital in 1983. I built a good orthopedic department. I think the important thing that drove probably me into the administrative field by the management was the fact that I could hold an excellent orthopedic department in the hospital. When the hospital was started, it was a very small hospital. It started in 1979 and we had hardly 150 beds. We were running an undergraduate training program only. And out of those 150 beds, I managed to fill in 40 beds for orthopedic surgery, whereas the major departments did not have that many. And I think the lesson I learned from that and the way it happened to me is probably because I was able to hold them together only because I worked with my heart. I think that's the first thing that I would like to convey here. Most of us get lost in administrative machinery, rules, regulations. We don't pay attention to individuals and their personalities. So I could do that because of that. One simple task which helped me keep a team of orthopedic surgeons. I'm sure all of you understand surgeons have the biggest egos. And everybody else is there. I stand for it. And the only way I could hold them all together was the fact that whatever we did together. We never had even a cup of coffee without each other. And the team was about 7 in number at that point of time. It went on for a long time like that until the department stabilized very well. And that's what probably was driving the higher management, pushed me into this post of the medical administrator in the teaching hospital of the Army. That's what the first thing in my experience as an administrator, as the head of department was.
Very relevant point on using the heart as an administrator rather than just the technicality and the operational things. So that's a great point. Go ahead.
There are a number of issues which I have learned during the course of my being an administrator, in addition to being a busy orthopedic surgeon in the department. But I was pushed into this role when the remodeling of the hospital was happening. The teaching hospital was in poor shape, and then a lot of things that the reasons why patients did not come and the true numbers that were required for regulatory authorities and also for training purposes. Despite the fact that we had excellent faculty in each of the specialties, they are very good faculty. Was that building the infrastructure was not good, and then equipment was excellent, the infrastructure was not good. So I started going by saying that you need to monitor and regulate the development of the new infrastructure. It is not building a new building. It was modifying an existing running hospital, which was a big challenge. So that made me forcibly to learn a few things about what are the regulatory issues in hospital infrastructure, what is it that is required for actual evidence-based delivery of healthcare. So all these things, that itself gave me a huge learning experience with infrastructure building to deliver good evidence-based healthcare as well as to meet all the requirements of the regulatory bodies of medical education. This also came up with a lot of clinical issues of quality control. So by default, the director of the hospital was the chairman of the infection control committee, and therefore I had to update myself and educate myself first about all the infection control practices that were there. And it was started a big change for the entire institution, not only for me but for the entire institution, because as was mentioned, antibiotic usage was being done randomly and with no specific thought behind using the times when people were giving antibiotics for 15 days post-surgery, as against what we do now with a single dose of antibiotic post-surgery, and that's about it. So that was one of the quality issues which we monitored, and then another quality issue which Dr. Gupta spoke about is the number of days of stay in a hospital. Though the regulatory authorities needed so many patients to be staying in the hospital, we never kept so many patients because of requirement of regulatory authorities, which is a very sad thing to happen if it happened. But so that itself was a drain on the resource of the hospital, because more than 60% of the beds in that hospital, the teaching hospital, were free beds. In its entire sense that it was completely free, there was no charge for anything at that point of time, because they wanted more patients to come in for the training of undergraduate students. So that is where I got a little insight into quality control of this healthcare delivery.
Sir, I think what we're hearing from you on the administration side, if you don't mind, I'll couple up a few of the other dimensions as well, and then come back to you. So when it is, I'll probably go to you and then come to you on the pharma side. You have been in that probably on a global role. You're looking at India and various other regions as well. What's your story? What's top of mind? What motivates you, and what's your passion in this area?
So what motivates me in this pharmaceutical field for the last 15 years is that we have been a pioneer. The company which I worked in was a very small company, but we have been a pioneer in the field of reproductive healthcare, or what we commonly call as contraception. So this field of contraception is a very important population policy planning subject for governments in the low and middle income countries, which is practically 90% of the world. And this pharmaceutical world was ruled by the multinationals. Still, our company came in 2001 in the international scene. And while people understood the need for population control and a good quality medicine, affordability was always an issue. And that's when we, as a company, when we came in, we decided that we don't need to be in too many therapeutic segments. We will focus on only this therapy, make sure that we provide affordable contraception of the highest quality and at prices which are completely different from what the innovator gives or the multinational big pharma gives to the countries. And I was pleasantly surprised when I used to attend international conferences globally, when health people of the stature of health secretaries, health ministers of various countries in Africa, Asia used to walk up in the symposia to say they are proud that an Indian company has been able to beat the big pharma, American and European companies to be able to give high quality, affordable medicines which are able to help our populations. That's been a very inspiring thought. And if this gets added further, then the company which I used to work with has been taken over by a very big American multinational pharma company called Mylan, which incidentally is the biggest supplier in the earth for HIV medicines. We do about $1 billion of HIV medicines in more than 100 countries across Asia, Africa, and Latin America. And while the company makes profit, it does good business in the US and Europe, which is more than 60% of the business. What really inspires all of more than 1,000 employees who work in India in this company is the success stories of smaller countries, the countries in Asia, Africa, India, Latin America, which says that thanks to you, we have been able to get affordable medicines in HIV, in malaria, in TB, in cancer care, which today is able to, for us to save so many lives from not potential, definitely death. I think that's what I believe our Swami would have loved his students to, be in such kind of industries which make a day-to-day impact in the lives of people.
Right. And, the story which is coming up, and, we talked of all the dimensions earlier. There is focus, there is intelligence, there is operational efficiency, there is administration. And there are the bigger pictures, there are the bigger issues, there are the macro issues which affect affordability and accessibility. And, as you probably led me to Guna, and I know he's a role model among many alumni, somebody who probably just walks around with 2 pairs of clothes for the last 10, 12 years and day in and day out just wakes up to serve the society. Would I want to hear your perspective from what drives you, what's your passion? The way I'm trying to connect all this together is best understand the different dimensions and then probably also take the right messages for the students who are right here in our audience. Yeah. So after Guna, we'll come to the insurance part as well.
If this can be some kind of 2 cents from my end. So the word healthcare is what we are spending time on. So from a student's perspective, question to ask is, do we want to be in health care or in health career? So I'm deliberately playing on these 2 words. Do you want to be in health care or health career? They're not necessarily in conflict. I don't want to position it that way, but it's important to prioritize what comes first. Because if it's careers, there are plenty of options. And over the years, having spent a lot of time with healthcare professionals, there's a big challenge because if you're going to encounter sickness every day, and very often not curable, we have to accept that many sickness, many ailments we will not cure, we can at best palliate. Okay, so with that kind of scenario, the human physiology has a capability to slowly kind of cut off some of those signals to your brain and not to respond. It's because if you are encountering every day, how do you ensure you are re-energized and you can still bring in all the empathy and energy to serve somebody? If it was just a career, then very quickly you will be enveloped with that insulation that, yeah, it's just a career and you'll just go on about it, but we will not be in healthcare. So if you want to make that choice, I think it has to be very clear that it has to be healthcare, and where we can every day find ways to recharge ourselves, to bring in the best of our capabilities, empathy in the service of the others who are sick. And I think the most, to me personally, because as over the years I've spent time an increasing scale with our work, especially in public health, I realize it's almost like a losing battle. Sickness is never going to go away. Sometimes these fundamental questions can arise. Is it really worth it, or you just leave it? So to me, then I think again the bedrock is essence of what Bhagavad Gita teaches. That you leave the outcomes aside, and if there's one place we need it most, the essence of Bhagavad Gita is in healthcare. That we just keep doing our best, and that the resources will come in, and the outcomes. And so, despite this question ringing all the time, are we able to make a difference? I think the only thing that keeps us going is that we see positiveness. We see some outcomes which will re-energize. We may not be able to change everything, but yes, those little things that we do will kind of motivate us to do more. So that's, and I was asked a personal question. Vineet was asking me, what's your primary drive to be here? I think it is I am in a unique position to answer this in a very simple way I would put it. I personally have been a recipient of such benevolence and compassion for all my life, being a student from primary to, I couldn't think of any other way but just to give back and be involved. And so to my friends here, I'll say career should be incidental. Okay, if it is any kind of service activity that costs should right, and I want to close with this one that we should look at CL. In healthcare, CL is casual leave, right? So any career we choose, not just healthcare, we should never have to think of a casual leave, right? There can be some emergency leave, some health sickness leave, but a casual leave, that is one word I've never come to grips with in all my life till now. Because if you choose a line of work that you love, you will never leave a casual leave. I've never had in my 16 years after passing out from college had to ever think of a casual, never felt exhausted. I think that's the key thing, whether it's healthcare or education we want to get into. And if it's healthcare, it's all about forget the CL, think about caring, and also very important is learning. And since morning, all the speakers have said the importance of learning, and medical field is, I think, one that reinforces continuous learning. It's not just one-time learning. That's the cornerstone of any healthcare work is continuous learning, caring and learning. So,
maybe you will talk gymnast in our days, that is also keeping you going strong. So one thing which what I understood from the three comments, and Manish, will come to you in a minute after Karthik, is that irrespective of which dimensions the panelists are, I think what the tribe is far superior, and I think that's what's the bigger story, right? I think they have embraced the sector for the feeling and the fact that they are able to probably touch lives in moments that matter. That's what I'm carrying out. Karthik, I read your introduction and it said insurance master.
Okay.
So I think we need to listen to your
Sorry.
part.
At the very outset, Pranam to Swami, and thank you for the organizers for getting us here. At any stage, I would never say that I am an expert in any field. So I'm just very happy that I've just come here to Bharti and trying to share my thoughts. So that way, I'm really grateful. And whatever, I think one of the members earlier said that whatever happened to us, or at least to me, was a product of circumstances. So it is not, and obviously mainly by Swami's grace. So it is not that we have done something great. At least I haven't done anything great. So that being said, why am I in insurance? Why am I doing this? What is driving me? Can I ask you guys a question? How many of you have insurance of any sort? Have you taken personally? Any of you, just raise. I can see about 5 hands and maybe more here. We are 150 to 180 people in this hall. Most of us, all of us are educated, very well understand what is risk mitigation and all of that. Yet 5 out of 150. And I'm telling general statistics is 1 in 20 people have insurance of any sort. And come to think of it, there is 90 more people who I could help try to risk mitigate. But that being said, what I also understand is, at least married people will understand this, insurance is much like being married. It's a necessary evil. You can't live with it, you can't live without it, right? So
I'm making a comment.
yeah.
I don't know whether married people will understand or not.
It's up to them, but yeah. So the thing is, you may need it, you will need it, but why is it that most people don't take it? Because they don't see a value in it. I'll give you an example. I've been helping out a small project in the parts of Vijayawada, the rural people. We've been giving them insurance, and we've been asking them, listen, can you at least do a little bit of contribution towards your own premium? Rest we would take care. And so we're giving you cover for about 1.5 lakh. your contribution as a family is only 1,500 rupees for a year. And that part of convincing was my work. Very difficult, especially, and even into the villages, going there, trying to explain to them, extremely difficult. Then come Shankranti, every Shankranti. You know that there is cockfights available in most of parts of Andhra, right? It's illegal, okay? Yet you find people, dozens of, like hundreds of people getting into these illegal cockfights, and the same villagers whom we go and say that please put in 1,500 rupees for the health of your family, they end up taking out like 20,000, 30,000 from their pocket and putting it into those cockfights. Because why? Because at some point in time, they think that they would probably get 2 lakh, 3 lakh, 4 lakh rupees back. They see value in that. It's so funny because I think October 2016, we had this demonetization. Around later on that time, those 2,000 rupee notes came out. Okay. In January 2017, I still didn't have, I've never seen these 2,000 rupee notes at that time. But I had by chance had an opportunity to go and see a cockfight, and the villagers, they were taking out wires of 2,000 rupees, new ones. So how did that happen? Why is somebody so interested in betting their whole yearly savings into something of like a cockfight, but not give importance to their own health? So my biggest challenge and what drives me is to push the boundaries and try to see how convince people that probably insurance is a small way to mitigate your risk. That is what is pushing me. I'll also give, and probably the insurance people are the worst or most hated people with all the hospital managers, doctors, right? And even the patients. For example, let's say that ma'am was there and ma'am had insurance and she's gone to a doctor with her father's the cardiac thing. And first of all, most normal people do not understand medical terms, right? And everybody feels whatever doctor says is the right thing. So the doctor states, yes, at this point in time, there's a bypass needed and a cardiac surgery needed. So let's assume that I had my insurance and I feel okay. Great, my dad has insurance because this is the great thing. And so doctor says cardiac surgery done, agree. Okay. One day later, I get a call from my insurance agent or a call, sir, actually your dad had pre-existing, we can't cover this, we can't cover that. Who is hated the most? It's not the doctor, obviously, because yeah, for one is you don't understand what is the medical terminology and all that. Worst is here, you don't even understand English because it's there, like we insurers have put terms and conditions which nobody understands. Why? Why is that? Like, is there any way, make this simple? And we are not needed in this whole circle of life, right? But again, necessary evil. So my whole, at least in the last 3-4 years, has been how do you make things, innovate products in a very simple way, get things out very simple, make things life simple, and that is something that is pushing me.
Great, and a very relevant topic, especially in our scenarios, and the fact that you are in the in tier 2, tier 3 cities where you talked about the complexity, the mindset issues. It would be probably something you wake up every day and find multiple dimensions within this dimension. So that's exciting. Manish, I came last week. The reason being that technology, digital, AI, ML is everywhere today. So irrespective of which field we are, I have been recently in conferences where people say we don't need marketers, we need data scientists who should become marketers. I've been in scenarios where people say the game changes data. The game changes the technology. So, after you hear these people and you being in healthcare IT and technology expert, probably you are interfacing pretty much in all the dimensions. So, what is the wrap you have in mind? What are you thinking? What drives you as well?
Thanks for the organizers Thanks to the organizers for having me here and Pranam and speak. Uh, to speak in front of my, I would say, our teachers, it's a great opportunity and honor. I want to say that upfront. Thanks to the Department of Management for arranging this. Seeing them sitting over there itself is a great feeling and an honor. Having acknowledged that, I started into this particular thing, if I would need to recall, coming to the data part now, just a bit of nostalgia, please bear with me. So I started into this particular journey of mine, passing out from MBA in '99 and did a year of work in Delhi. And maybe it's a circle of life, you call it. The next year I was back in a company which was developing health information systems. So in 2000, I joined this particular company in April, and my boss says to me that, Manish, the new hospital in Whitefield is coming up, and why don't you go and approach and figure out whether we can install our software over there. So being new to the job and figuring out whom to approach, we went and met with the director over there, and incidentally we got a chance to implement our system over there. And if you want to probably tell the students which is the best place to probably learn healthcare administration and management, that's how my journey started. And coming back over here, my learning was from the hospital, learning with the doctors to understand what are the nuances of what are the workflows that they go about. Each of that we learned in those 18 months that I was there in the first time that I was implementing at the hospital. And one time, I believe, unfortunately wasn't there, but I heard it later and read it in a book, that Swami did mention that, see, two of my students, they came back and contributed back to the organization. I think so that was the biggest driving factor for me till date, to figure out ways and means that how I can contribute to the society in different ways. And during that particular learning, while we were at the hospital in Whitefield implementing our systems, we realized the need for the data that needs to be captured at each point, and implemented all of those workflows within the system. So in those days, there was, probably a scenario wherein not much of systems in hospitals used to be once in a blue moon kind of an opportunity. But of late, I can see all those learnings that I've been through during that initial time, when we learn from the doctors, we learn from the nurses, we learn from the lab technicians as to what exactly is required in each of these different workflow touch points. We incorporated all of that into our system, and in today's world, we are seeing a lot more of this happening. You see, those were the days when you used to build ERP kind of systems. So I had a very tough time going to my friends and explaining what company I was working in. So I knew SAP and Oracle used to be big. I used to tell them, see, we are making an SAP or Oracle for the hospitals. But now everybody understands. I heard doctors mention about the way they are innovating using data and driving that particular innovation within their unique cases, and very interesting examples that I have already given. So I feel even though data is becoming very important, it still is probably secondary to the knowledge that needs to be taken from the workflows in the hospital. So until and unless each of us understand what exactly is being recorded in the system, or in the workflow, that needs to go into systems rather than the vendors. I've been in some companies which we created the hospital information system and we presented a workflow from a particular hospital. But when we came back to another hospital, it was unique. Each instant that we went to, each hospital that we went to, we found that their need in that particular use case or in that particular instant is unique. We might have seen a use case of patient registration in one hospital. It was completely different when we went to another hospital. So incorporating all of those with real life examples and all of that probably is something which needs to be done.
So, we have touched pharma, administration, insurance, working for the society, technology, and I know that there are probably, and Dr. Siddharth mentioned many more dimensions, the healthcare delivery systems, public, private. Here are examples of people who are really into this. I can go on. I think the knowledge of the panel, so much more can be brought out of it. Probably I'll keep some questions, but I may not be able to go around the whole panel because of paucity of time, and I know that the tip been passed to me already. Rather, Venkatesh, I'll ask you, and I'll come back to Dr. Sundaresh. So currently, right, when you go to work every day and you think of your area or you think of your segment in healthcare, and you look ahead, what are the game changers you want to drive? I mean, what is it that you're going after which you feel is the game changer and is the exciting path ahead?
Yeah. So my job has been more to do with outside India and the international markets rather than India. So the biggest challenge and therefore the biggest opportunity I see is that India is the future, and that's something I wanted to share with all the younger brothers, that the world is looking up to India, and India, whether it is a leader in teaching, whether it's a leader in technology, whether it's leader in markets, I think all of us, all of you youngsters who are going to look at careers, must certainly keep India as the first and probably the only option when you look at your individual careers. Coming back to this phase of India is probably at an inflection point where we can probably be the global leaders in every aspect of life that we can think about. And this is not just because Swami has of course been talking about it many a time. In fact, in some of our interviews where alumni were called, he did mention that it's a matter of time when India will be back as the leader, not only spiritually but globally, economically as the leader of the world. And this is slowly but surely happening. And that's where you see, whether in a pharmaceutical industry in specific or the healthcare industry in general, or even industry overall in general, there are so many things which we can implement from global best practices, or we have such unique problems that only India has. So when you have problem, you can either look at it as a pain in the neck, or you can look at it as an opportunity for us. So I see every day when I go to office, there is so many problems that India has, India healthcare sector has, India pharmaceutical industry has, that there is so much space for innovation. And innovation doesn't necessarily mean just technology. Innovation is simply finding a simple solution for a simple or a complex problem. And that's where there's so much opportunity to get global best practices, understand what's happening globally, and take the best of every single country. I've been to more than 60 countries across 4 continents. And I can list out what are the various best practices in healthcare happening in various countries, which we can easily implement in India, and which will probably make our health sector one of the best in the world. So that's what motivates me when I come to the office daily, and this is a problem which many of us professionals can use our experience and exposure to work on.
As recently partnered at NASSCOM conferences, and the same sentiment from many leaders who are India-facing leaders and And they were like, oh, there will be big companies sitting in developed countries, but 1.2 billion people, we know where the masses are, so you really have to implement, activate, adopt, embrace. This is the place to be. I'll probably give a little spin to the question, but the same question, sir, to you. So, in your, as Swami's hospital director in Whitefield, when you think ahead, when you think of the future, what do you feel can be some big game changers? What do you want to drive and, looking ahead?
I think the message to the people who are not only interested in healthcare administration and who are sitting here eagerly for the last 3 or 4 hours is that if there's one place where you can learn healthcare administration in its totality, is in Sunnyside Hospital. Because it encompasses every aspect that you have heard here today. It addresses Sunnyside Hospital, not necessarily the super specialty hospitals that we are seeing in here or at Bangalore or at Whitefield. The Sunnyside healthcare mission as a whole has outreach centers, how the outreach model has worked, and how secondary care center has worked in the shape of a general hospital at Puttaparthi as well as in Whitefield. And then the tertiary care hospitals in the form of a super specialty hospital. This has been established as a model, and this model is something which can be replicated. And I think each one of you who is ambitious enough should see how we can do that. It is not a simple task, and unless you educate yourselves in doing it. There's only one thing lacking in this Sai Healthcare mission is to how to raise money which doesn't come from any of these institutions. For that, we'll also hope to give you an insight to sending you to some of the institutions during the course of your training process, where you can get much more insights beyond what you learn here, like maybe All India Institute with their purposes there, or Vijay or many other hospitals within the Bangalore city, where you do get to see what is happening and you can get the best of both worlds. There is a need for this kind of a profession, which will release the doctor to do his job of doctoring the patient and taking care of patient care activities rather than sit in the office. How I wish I could do more outreach surgery rather than sit in my office. I do that to the best of my ability even now, but I think there is a need in the healthcare sector because the medical curriculum today does not inculcate any program or subject of administration at all. There is nothing. It is a 50 or 100-year-old system which the British has dumped on us, which we are blindly following. And there is no aspect of either soft skill development or managerial development programs. So I think that's where the future is going to be, and I think that's what I'm looking forward to.
Thank you, sir. Being very honest and very transparent views, and talking about transparency, you saw Jenny come back, so the previous state which was passed is irrelevant, now I have some more time. So, one more which I'll back up, you mentioned that the future is there. From a different angle, I was thinking of the students, many times when people are doing MBA and they obviously want to be smart in their general management skills, they want to be good in their soft skills, they also have a angle of technical skills because people come from different background. When I look at my area, when I look at data and analytics, all the buzzwords of the deep learning, the machine learning, the artificial intelligence, McKinsey did a study recently and they called out 3 industries where they feel there is maximum possibility of advanced predictive analytics. and which are going to be game changer industries from a perspective of adopting artificial intelligence and machine learning. And I was listening to the talk in the morning, and there was a mention of precision health. And if you've not understood that concept, it's a really interesting concept you want to go after, because it gets personalized. So your health is personalized. In fact, there is a term which is radically personalized. Right from the time you're born, your genetics, your genomics, what is your make, and what the medicine can be prescribed to you comes back in a different format. Now, whenever this gets discussed in global forums, and I see people from India, they're like, well, our problem is affordability and accessibility. We think the precision health is a far off angle. But I also hear that with the power of advanced techniques and data, this can get closer. And I think the diabetic clinic example in the morning kind of made you feel that it's getting much closer on the technology front. So, great perspective, Venkatesh and Doctor, on the future, where you see in your area, in your category, in your dimension. Now, I'll probably change the question a bit, and for Karthik and Guna. We are talking to an audience of students who obviously have multiple areas they listen and they learn, right? So from our students' perspective, when you want to give them a message that, hey, these are the things which you should focus on when you think of the sector, and these are the things which can help you to build your awareness, your knowledge, your understanding, what would be the advice you're giving? Because if there are people who actually want to go for these electives and want to know more of the sector, where should they get started? Where should they go? Any personal advice from a perspective of knowledge, awareness about the sector? So, Guna, you want to go first, and then we go to Karthik. And then it's fine.
You might be disappointed. With my response, I won't recommend anything that you should specialize now. I'll say pick up your general management skills. And of course, the fact that whatever I'm doing currently, in very large scale programs on primary care, of course working very closely with several partner non-profits, with the government institutions in primary care, tertiary care, palliative care, and nobody from medical background side, but it's about, I think the key thing to do is learning to learn. Whichever situation we are in, what our education should be able to do give us is that confidence to quickly learn. Any given problem to us, can we quickly learn? Today I can have a reasonably good conversation with doctors across specialties, and often I'm mistaken to be a doctor. Okay, well, but that is not the intent. But the point is that you can pick up whatever you need to. That's the message I want to convey. That just where you are now, whatever basic subjects we are, it's about applications. Each day we have new problems. I'm learning. What I want to say is I'm learning every day. Okay, each quarter I have a new challenge in front of me. I feel like I'm starting on ground zero, absolutely on ABCD every month. Okay, and it's a good thing. I think it's good to sometimes just forget your CV, what you were. That's another thing I wish every place I enter, can we just avoid the CV? I don't want to introduce myself. I am a new person here. This is a new problem you're posing to me. I'll start from the scratch. Whatever I have is a plus. If some of what I have from the past is useful, it's a bonus. Okay. So I think by the time you finish 12th grade or even undergrad, postgrad is more than enough. If we have learned how to look at any problem, whether it's a science problem, engineering problem, or a management problem, an approach to problem solving and application of time. There's no shortcut, a lot of time. And the only other thing I would add is when we get into problem solving is don't give up. I think this point became recurring in the previous talks in the morning as well. Sometimes we're a bit sent after investing so much time. there's so many I can share in my life, but I'll talk something that's fresh in my memory. Okay, just to put some context to it. So you see, one of our biggest volunteer outcomes initiatives has been developing an open source hospital information system, developed entirely by a dedicated volunteer force. It's perhaps one of the biggest successful open source projects I can say in our country, which is now in use about 30 government hospitals, from area hospitals, district hospitals to teaching hospitals across AP and Telangana. And we got the next challenge, a very intractable challenge. A few weeks ago, invited by the commissioner to implement it in Osmania General Hospital, the oldest hospital in this part of the country. Very, which has so many achievements to its credit. It's 150-year-old hospital. Okay, and typical of such institution, unlike our institution here, the modern institution, everything is in a compact building or one or two buildings. This is organically grown, several buildings scattered around in so many places, roads cutting across. So to this day, if you want to implement a web-based application, it's a nightmare. There is no connectivity in the heart of the city in Hyderabad. You cannot be assured of 24/7. So in this 30 hospital, I keep getting calls even now, and our team, the system is down. So we have to check, is it a server problem or their local connectivity issue? And very often we figure out it's there. Then they have to tell them, sorry, that you have to figure out because we implement this as a free. So we said, no, we are not going to take on this problem unless we work out around a solution of having both a seamless offline and online application which can sync up. And you won't believe, we went back to drawing board. Last 1 month, personally, I've done coding from college days, in fact, from school days, and even now, my work doesn't allow me to do code, but if I can be not bothered about anything else, I just lose myself into coding. So I would have spent in the last 1 month at least 5-6 late evenings from 9 till about 1-2 in the night, working on this offline module. Not just me, with 2-3 others. What I'm coming to say is, do I have to do that? I'm not doing it all the day, all the time. But here's the problem. And what was I sitting? I was Googling, finding out a problem, how there's a technical issue there, picking up a piece of code here, there, patching it. So what I was trying to convey to this message is, forget, you don't have to worry too much about what skills you need to pick up. Whichever role you get into, pick up whatever you need to. And I think that's what our education is giving us on a platter here. So
Thank you. That's a very liberal view.
I want you to disappoint you. I want you to textbook answer for that.
And I think but there's a message in the view, because you don't have to probably get over stressed about the technicalities at a stage when you probably want to pick up the nuances and get your heart and love the sector and things. But as you get into the doings of it, the game changes. But thanks so much for sharing, because that's how you have built your build your career, your message, and that's how you wake up and do things.
Yeah, and I want to close. So you can witness on Tuesday we are launching 150-year-old institution, the most premier institution. To this day, it's all manually written, this OP scripts. And from Tuesday onwards, 2,000 odd patients will come there with the proper
I think the same question, from
The answer is not very different.
Oh yeah.
So
here is another example who's very liberal.
So, how many of you know swimming? Okay, like slightly more. Sorry, yeah. So come 31st March, sorry, now it's April 15th, right? Come April 15th, everybody has to swim. What this means is, all of you will be jumping into some kind of a swimming pool, which means you don't know your life, you don't know which job you're going to get, but you have to get into it, right? So what I'm trying to say is, when all these experts have come here and spoken and given you so much of their insights, secondly, you have access to so many people for knowledge. These are great flotation devices. So the knowledge that you have, whether you need to choose medical care, you want to choose banking, you want to choose insurance, you want to choose anything else in life now, is that you guys have got great flotation devices to make and to get into those pools, which you will anyway have to swim. Whether you have this or not, you have to learn to swim. So, and the only way you will do is to innovate. Now, whichever field you're in, you have to innovate. And that's the only game changer that is ever going to survive. And so, if and like I'm 100% with Gunaranjan here, saying that it doesn't matter which field you're in, it doesn't matter what you're going to take, no specialization. Just be very simple, think very straight, and innovate. That's enough. And I think now more than ever. In fact, when I was passing out in 2000, 2003, all we had was access to an HDFC bank would come and say that I would like to take 8 or 10 people, right? And then for one, I was just like, I was maybe stupid or whatever. I didn't want to go into a bank. I don't know. I never knew what is a bank. Forget that is okay. But I just didn't want to go into a bank. So it is okay. Bank is one swimming pool. You're not jumping in, but you're going to jump into some other swimming pool, right? Again, no flotation devices. No, I didn't know swimming. You learn on the job, right? I'm not saying I did great. I'm only saying that you learn as you go. The faster you learn, the better for you. And that's why I'm saying, Gunaranjan, whatever he's saying is, don't be very specific on what you want. Like, I know people who have come to the Catalyst and all this saying that, oh, I want to be investment banking. Do you even know what is investment banking? Like, I want to be only in like credit and what. Yes, get to know those things, but be open to learn on the job. And learning to unlearn is the first step.
Thank you so much. I think great points from a perspective of when you reflect back and when you sit today after many years and you put yourself back in the shoes of your juniors. And I think what comes out of your mind is the simplicity, the openness of the mind, the innovativeness, the curiosity. But what I'm taking away from both your comments is that what probably doesn't come in your mind as the top thing is the technicality of things. Is that a right read?
I think
because from
I'm sorry, but I want to disagree a little because technicality you will eventually get when a person is 100% on the job trying to understand. See, nobody can be just like, if you don't deep dive into any situation, don't understand what the situation is, you cannot just be just like gender manager, chalta hai. That chalta hai attitude will never work. It might work one time, it might work 2 times, but unless you start deep diving and understanding what is the situation, so that's where I'm sure technicality comes in. But I'm not so sure if they will be able to concentrate on that technicality right now.
Okay. Thank you. I think that's a good clarification. Jaideep, do we have 5 more minutes? Because I have one question for Manish and then I'll end with Dr. Sundesh.
Can I ask you?
Sure.
See, in Indian system, 2 things happen, and that is Janta hai and God. That has to now be kicked in a new scenario. And the best thing you will be asked, sir, you will be asked, what do you add to the organization? The clinician, the doctor, the dietitian. I have operated 10 cases of bypass surgery. I have faced 20 giants, and I have seen 200 patients in the OPD. I think this is what you add. It is the most important thing. Because unless and until you innovate and you add to the value to the organization, you will be marginalized and you are a liability. And then sometimes the clinician said that the clinician's value is put in the corporation 2 crore rupees, but he says he will generate value of 5 crore rupees. Oh, what you can do? I tell you once you can say, for example, somebody asked me in beginning of my career, hey, what you have? You have liability. I said, when you leave your office, you keep your phones, you keep your lights and ACs on. I have given a simple order, put in my own man, who will switch it off all the expectation and life, and the bill of the company has gone down by 10 lakh rupees per month. I have added value of 1.2 crore rupees. So why? Innovation. Another thing that I got started to purchase the medicine and got a discount of 25%, and our purchase, local purchase was 4 crore rupees. I added value of 1 crore rupees. So my dear friends, you have to innovate, you have to do the percent. All of us have done inspiration, and there is only 1%. 99% will participation and you will have to do it. Unless otherwise people say that the जुगाड़ से नौकरी लेनी है और नेटवर्किंग से चलती है. You have to have
So I think again, sir, very well put with a good sense of humor wrap. And I think the message which came out of it is that there is nothing which is just there to be taken off the table. You know, you have to add your mind, you have to add your innovation, you have to add your expertise in your unique way. So I think for the students, I'll probably shift back the focus a little bit more on the sector. And you know, Manish, when you were talking earlier, you talked about how you got started and your experience with the hospital early on. Generally, technology and data and analytics is considered as a powered path, right? What would be the top thoughts in your mind when you look at it and you look at the future? And I'm going back to my question which I was asking to Venkatesh. What feels like the top game changers to you in the technology angle relating to the healthcare sector, being in the healthcare sector?
So in terms of the technology, what we are seeing is it's getting more and more data driven, as you were also alluding to earlier. And what we are finding is that a lot of decision making, like how even Sir has indicated earlier during his presentation, that's coming back to the need for the data to be presented and what are the data stories that it can tell. So it's no longer just in terms of, it's not sufficient that you just capture the data point, as I was alluding to earlier when I started out my journey. But now, how can you tell the stories with that particular data? And that particular bit is becoming more and more important. As you would see, I curate a blog of different healthcare IT experts sharing their insights via that particular blog. And there we have listed about 71 startups that are there in India. And the focus of the blog is what's happening from a data perspective in India. And you find that a lot of these startups have started focusing on very unique use cases. Before we used to be talking about start to end, right? From the time the patient has come to the hospital to the time he or she has been discharged. All of that particular thing should be recorded in the system, so-called ERP system. But now you would have, I'm sure everyone has heard about Fracto. They started out just by innovating the appointment space and the stories they were able to create based on capturing that particular patient and take the ease of use. We have all faced traffic in Bangalore. You know, by the time the patient reaches the hospital, appointment cancellation happens, doctor has gone for another meeting or so on and so forth. So all of this particular thing is being tied down now to defining what these user stories are, what these data stories are, and how that can be implemented in the system. Another point which I would like to make for the students in terms of like the steps forward, so to speak, from at least a healthcare technology perspective. So from a technology perspective, if you're getting into healthcare technology at any point in time, make sure you know how to code. Again, the example is sitting right over here. At every single time, I'm an MBA. Earlier, I did my MSc in physics. I learned a bit of coding over there. In my job, I learned coding, then went on into implementation. So you get into a bit of a managerial position. But now, when I have to create my own blog, for instance, I went back towards coding because I had to deliver stories related to data using technology. I have to go back and relearn the coding of what's available today and then implement all of those aspects.
And I'll take a scoop out of your conversation because being very close to the same area, in GE Healthcare, across our imaging, our ultrasound, our life care solutions, around life sciences, around healthcare digital, what we see is quite a lot what Manish has been talking. That data is coming a lot to the center. And the reason it's coming to the center is that the customers, whether they're healthcare institutions, all the patients, all the physicians, their behaviors have totally changed. So they are becoming a much more data-driven digital customers, and that I think is a big exciting part in the healthcare sector because it is feeling more and more innovative, and it is feeling more and more data-driven as such, right? And today, when we look across, smart administrators who can get the program, who can get the concept, who can get the pretty much the flow and build innovative products. And you mentioned startups. I was recently looking at a startup chart. I mean, there were some 300 companies, and the categories they were all lined up were probably categories that we talked about a few years back. There were like in this 10 startups in natural language processing. There was another 10 startups in visual assistants or robotic assistants, and it was looking like the spectrum of startups itself is getting totally changed. And the message which I read in one of the conversation was that one of these startups probably in the next 3-4 years would be the next Amazon or Google. And another interesting concept I recently saw that non-traditional healthcare companies are actually getting into the space of healthcare, and including companies like JP Morgan Chase or Amazon, and they're trying to build collaboration because they feel that they can be the game changers of the future. And these are like big, big conglomerates, big companies, because the reach exercise will be changing. Thank you for that. We will wrap up with this last question, and the question is to you, Dr. Sundarshan. Maybe a question around the reflection of today and a message for tomorrow, because we want to wrap on the day and what has been your reflection and what is probably your final few messages as you go on this journey. And I know that the idea and the vision came from you about providing the students a specific healthcare kind of initiatives.
So just to interject here, because I want Sir's thoughts to be the wrapping up thought. Vineet, you have been moderating, and one of the thoughts which I feel that from your side, which you can share for the student community, is you have been leading marketing initiatives for pretty much a lot of medtech products across region. And one focus which I wanted to hear your thoughts from is value-based outcome products and alluding to affordable products, etc. So how do you bring in the corporate definition of value-based products and Swami's definition of value-based products, and how your experience helps in bring these two value systems together? Very briefly, if you could speak about that, and then we'll definitely hear from Sir.
So, Jaideep and me, we are colleagues in GE Healthcare. I think you wanted to challenge me in such a thing that I already I have to flip back on where probably I have. But I'll just, I think on a serious note, whether they're global companies or Indian companies, or public sector or private sector, or and servants in the morning that some of the sectors need to work together. One thing which doesn't change and which applies to everyone is the customer, the ecosystem of the customer, and what is the best way to penetrate and create value for the customer. And what we see today is that is becoming increasingly a focal point around 5 years back, it was an imaging manufacturing company. Their thought would be that art is making the best equipment and art is selling that equipment in a good box. Today, that dimension has totally changed. I think what they're thinking is that what is the best value we are going to create for the patient who is going to go through the scan, and not really the box, but the solutioning in the mind of the patient, and that is the genesis of any value-based product. I mean, essentially, when you talk about a value proposition, a value-based product, or a value pricing, you have to penetrate the ecosystem in a way where there's maximum meaning to the customer. The biggest game changers we see in this area is the fact that the customer behavior has drastically changed. There is no sale which happens today unless somebody has gone and everybody's having a huge digital footprint and a digital behavior. So the recall capacity is all on digital platforms. So every company who's in this market, and I'm not talking about the big cities. It is even in the smaller towns, and with the speed and the connectivity, the penetration is going much into smaller towns. So I don't think Practo is working on any big cities, and I think even in somewhere in a small tier 2 city or even in villages, they can probably start getting the healthcare information right on the app. It was interesting, we in GE Healthcare are right in the center of it, and across all our 7 regions, we have huge, just the think tanks and the task force. What does it mean in Africa, or what does it mean in ASEAN, or what it means in India? But one thing which caught my attention from an external perspective was I was looking at this predictions for 2020, 2022 from a company called Gartner, which is a big consulting company, and they put forward a lot of forward-looking views and thoughts. And healthcare in their top 10 prediction came up at least 3-4 times. The reason it came up is that it is meaningful to everyone's life. And the message which came out is that there is going to be a drastic change from a perspective of a patient, a system, a delivery mechanism, and the way marketing is no more the event and the branding, it's the digital platform marketing, which came up big time. So I think we're at the center of it. The products have to have the right price, the right value, so the fundamentals don't change. But the customer changes, and the customer changes, everything in the ecosystem changes. So that's my few thoughts. And I know that we want to dive deeper into some of the advanced analytics in healthcare, which we can do at some point of time. But thanks for your question, and shall we then go back to the...
I'm sorry for the intervention, but I thought it would be valuable for
No, great, thank you. Sir, so same question. I forgot the question.
No, I think I'll go back to what we started this whole workshop on, Swami's discourse. The message that Swami gave was, number one, it's not wrong to make money. And it is not wrong for each of you who are here to look forward to a career. And let's not mistake this to be expecting a completely honorary work in the Satyasai institutions. Even if you are willing to, I don't think we have the capacity to employ each one of you who graduate from here. So, first thing that we need to remember is it's not wrong to look at making money by following this as a career path, in addition to contributing to it by its quality. Number two is, I would like to touch upon the fact of data, which we have been, I have been in discussion with GE for a number of, at least 3 years that I have been there in the institution. We have the largest set of data in the healthcare industry, which is stored and documented extremely well between the 2 hospitals, between Puttaparthi and Whitefield. When I was discussing this issue with the research project which came up to us in the hospital, one of the professors from IIT Kharagpur was there in the meeting, and then I was mentioning about this data and then how we were trying to see which data can be deleted. You almost got up from his chair and hit me on it and said, please don't delete any data because it's a very valuable thing. So we have enough data there that can generate a large amount of information for the betterment of healthcare. Unfortunately, the professional team of doctors do not have the time to sit and analyze those data. That's a huge area of interest. If anybody is willing to do it, I'm willing to offer them an internship now. I'm serious about it. Because if you look at one aspect of valve surgery that is being done in this institution, and in this 27 years old now, or 28, 27, 28, and at the rate of 15 valves per month. I'm poor in mathematics, somebody tell me that it's a huge number. And we have been in existence in Whitefield Hospital for 18 years now. And that is at the same rate of 15 valves in a month. I think we'll have the largest series of valve replacement surgeries in the whole world. Unfortunately, we don't have the time. The professionals don't have the time. They have made publications, I'm sure there are publications to a small extent. But if we can consolidate those things and convey it to the world, it's a fantastic benefit to the profession. Whether it is digital data or handwritten data, immaterial. Today, the medical profession is bound by what we call as evidence-based medicine. And where is this evidence coming from? Volumes of journals and articles which have been published in these journals, which are still a reference point for us. Fortunately, today for us, it's all available in digital form, easy to analyze. Despite all that, we don't have the time. I'm calling myself we because I'm also talking. So that's one area where we can really make a mark and contribute to improving the quality of care by adding to the evidence present in literature today. And of course, in the long run, we need people in that. I reiterate what I said earlier, that there is a need for people in that level of professional management that a doctor cannot do or should not be doing. I would say very primarily, he should not be doing. He should not be allowed to say, I will manage my patients. No. Somebody else should manage the patients, how to route the patients and all that. And I'm very proud to say that today we deal with more than 1,000 patients in a day in the Whitefield Hospital. And we have a fairly efficient system, and I think the IT team and the other managers in the hospital manage these patients extremely well, and the doctors are not going to be worried about it at all. They just tell how many patients they can see in a particular day based on the other commitments. So that is where your inputs and your job will come into picture, and there's a lot of room for innovation. Whatever we have done is still inadequate. I think there's plenty of room for innovation in all these areas. I think I'll end by saying once more that if you want to train, I think the place to train is the Sai Healthcare Mission. Thank you.
Time for question to take first. So, if you have some thought, but my just one minute thought is that what we heard in this, 4-5 hours today are again multiple dimensions of this sector. And I know that each of you would have listened to it and interpreted it in your own mind. But the foundational few things which I heard was that this is a sector which is driven by the heart. People who work here, they really go to work in a way that they want to be change agents, they want to be making a difference. And I reflect back on my earlier thought that it was probably a very, very dear sector And Strong used to talk about it many times. We heard the discourse this morning, and we heard Dr. Sundareshan's thought that there's a great place to get started because there's a organization sitting right with the academic institutions. So those are a few of my thoughts there before for you. I think you're good with the panel. Thanks. I hope everybody found value in this discussion.
I would really thank all the esteemed members of the panel for lending their valuable thoughts. I think what Vineet has summarized is perfect, that this sector is at an inflection point where not just technology from a scientific point of view is evolving at a very rapid rate. There's data, there's need for global healthcare with aging populations and multiple dynamics coming together, which creates tremendous opportunities for all of us to lay our foundations for a career which is based not only from a career ambition perspective, but also driven by a passion for contributing to the society, making profit, making socially contributing factor in our lives. With that, I would like to extend once again my gratitude and thanks to all the members of the panel. I would now request Professor Kumar Bhaskar sir to please come up and hand over our expressions of gratitude to all the members. Kumar Bhaskar sir, please. I will call on Dr. Siddharth Nandi sir. Please accept our token of gratitude. I will also request Professor Anil Kumar Gupta, please come up and receive. I would now request Ms. Arpita to please come and accept. Thank you, sir. Thank you very much. I would now request Professor Bhatia sir to please come up and thank you, sir. And I would request the panelists to accept our token of gratitude from the hands of our dearest Bhatia sir.